Medicare in depth for 2022. There are essentially 3 different Medicare parts, each part offering a different aspect of coverage. Additionally, there are Medicare Advantage plans, which take a more all-in-one approach. Let's take a look at each of these types of plans. Medicare Part A is inpatient coverage. Part A covers hospitalization, including inpatient care in a hospital, skilled nursing facilities, nursing home care, but for rehabilitation only, hospice care, and home health care as long as it's treating an illness or an injury. Medicare Part B is outpatient coverage. Part B covers both medically necessary services as well as preventative medicine. This includes things like clinical testing, ambulance service, durable medical equipment, inpatient and outpatient mental health treatment, as well as partial hospitalization, a limited number of prescription drugs. This also includes regular doctor visits and annual flu shots. There's no copayment for most preventative services as long as the provider accepts direct payment from Medicare. Medicare Part D, standalone prescription drug plans. Part D is private insurance designed specifically to cover prescription drugs. Part D plans may cover different drugs, but always include both brand name and generic medications. Each plan must offer at least 2 drugs for each medical condition on Medicare's list. This ensures that people with different medical needs can still get the drugs they require. In most cases, even if the drug you need isn't covered, a similar one in the same class will be. Additionally, your doctor can apply for exceptions for medications not on your plan. Medicare Part C, also known as Medicare Advantage. Medicare Advantage plans are offered by private insurance companies contracted with Medicare to provide all of Part A and Part B services. You must have Part A and Part B already to qualify for an Advantage plan. The idea is to provide a more one-stop shop healthcare insurance and may also include prescription drug coverage. Here are 4 common types of Medicare Advantage plans: health maintenance organizations, HMOs, preferred provider organizations, PPOs, private fee-for-service plans, PFFS, special needs plans. You can join or change plans at any time during appropriate enrollment periods, and you can switch to Original Medicare, Parts A and B as well, but only at specific times throughout the year. Because most Medicare Advantage plans, like regular health insurance, have co-pays, deductibles, premiums, etc., you may want to consider obtaining a complementary insurance like a hospital indemnity plan or a critical care plan to provide a financial boost for treating serious health conditions. The main difference between Original Medicare and Medicare Advantage is that with Original Medicare, you're essentially cost averaging medical expenses by paying roughly the same amount each year. Most people need more medical care as they age. With cost averaging, your bills stay about the same even when medical treatment increases. In comparison, Medicare Advantage is more of a pay-as-you-go model because you generally only pay for what medical care you need. Most insurance companies even offer at least one 0 additional premium HMO and/or PPO Advantage option. What's not covered by Original Medicare? Well, coverages can vary from plan to plan, and it's a good idea to familiarize yourself with what each plan covers so that you can make the most informed decision possible. If you want to check a specific service, test, or piece of equipment, visit www.medicare.gov/coverage or call customer service at your insurance company to see if it's covered. Generally speaking, parts A and B do not cover the following as part of the plan. Long-term care. Yes, it's true, Medicare does not cover long-term care. Dental care. Exams for prescription glasses, dentures, cosmetic surgery, acupuncture, hearing exams and hearing aids, routine foot care. Recently, Medigap plans have begun including discount clubs and other bonus benefits with their plans to help pay for some of these items. For many years, the most common Medicare Advantage plans have covered some of these benefits, but coverage varies from plan to plan. And yes, that's what those ads on TV are talking about, the bonus benefits on Advantage plans. This is one reason why choosing a Medicare plan can be so complicated. There are a lot of types of plans to choose from and pros and cons to each type of Medicare coverage. If you're like most people, you have questions. Get your questions answered accurately and clearly by an experienced, independent Medicare agent by booking an appointment below, or download the Medicare in-depth charts to get a bird's eye view of how it all works. Stay tuned for our next post, How to Pick a Medicare Plan.